Do you hear that? Probably not. They wouldn't call it the silent disease if just anyone could hear it. I'm talking about osteoporosis, a disease that results in weak, porous bones prone to fracture as a result of bone mass loss. Osteoporosis can silently sneak up on anyone, but we know it specifically targets postmenopausal women.
We found that estrogen and progesterone actually increases bone density. And as women start to have a decrease in these hormone levels in their body, they have a sharp decrease in the density of their bone. So we have to watch women who are menopausal more closely and follow their bone densities to check for osteoporosis risk.
Bone density is measured with a special X-ray called a bone densitometer. This test is the only way to know if someone has osteoporosis. There are no outward physical symptoms. I guess that's how it got its reputation as the silent disease.
I follow women who are menopausal. I do an initial screening bone density at the age of 50, just to kind of get a baseline even before their hormones are depleted, because many women are still menstruating at 50. And then what I'll do is generally I'll do a follow-up bone density in about 2 years to see where we stand. Now, if a woman has normal bone, I may not follow up after that for another 5 years. If I've noticed that they are at risk, if they have what we call osteopenia, which is the stage before osteoporosis, then I will follow with bone densities every 2 years. If someone is osteoporotic, I may initiate different medications such as Fosamax or biphosphonate therapy to increase their bone density. I also would recommend to the patient that they do some weight-bearing exercises and take calcium and vitamin D.
If women do not have their bone density measured, then osteoporosis is often not discovered until a weakened porous bone suffers a fracture, usually in the back or the hips. Bone fractures might not sound like a big deal, especially if you remember breaking your arm as a child and recovering just weeks later. Having a fracture as an adult is a lot more debilitating, and once you have an osteoporotic fracture, you are at high risk of having another. In worst-case scenarios, these fractures can lead to further complications, hospitalizations or bed rest, and perhaps even a permanent change in lifestyle. That's why monitoring bone loss is so vital for the active older woman.
There are a lot of risk factors. Smoking increases your risk for osteoporosis. That's at any age, but specifically after menopause, when you're not having the beneficial effects of estrogen and progesterone on the bone, that's when you really see a sharp decline in bone density. As well, certain dietary factors, women who have low calcium diets, certain ethnic groups are more prone to osteoporosis. So basically, in any woman, lack of estrogen does decrease the bone density, but there are certain inherent factors that can increase your risk. Women who have an underactive thyroid are more prone to osteoporosis. Women who've been on steroids for a long period of time are also more prone. When you have these predisposition factors and then you add in the lack of estrogen and progesterone, that's the population that you really have to be careful with.
In the meantime, women should do what they can to promote good bone health and prevent fracture.
I would just generally recommend that they do weight-bearing exercises. That's just an overall beneficial health measure that we should all take. Exercising like 3 to 5 times a week for a minimum of 30 minutes. I would recommend getting plenty of dairy in your diet. There are plenty of low-fat sources of dairy, yogurt, skim milk, cheese. And I would recommend not smoking and just generally being on top of your health.
Once someone reaches the postmenopausal stage, there's a higher possibility that she'll be taking medications for other conditions. Talk with your doctor about taking vitamin supplements. They'll know if these vitamins are safe to take with your other medications. And of course, be sure to follow through on the appropriate checkups, especially those regular bone density screenings. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.